everyone, it's Amy Scalia with Cincy Chic here with Dr. Gupta at the Dermatology Laser and Vein Center. And today we are talking about something you've probably heard of before, Botox. But we are going to get an insider's look on what makes it different, where all it can be used, and how beneficial it truly is. So Dr. Gupta, we know the cosmetic side of Botox, we've heard about that, but where else can it be used?
Right, Amy. So the most common areas we use it, of course, is still for aesthetics. It's still for cosmetic purposes. And of that, the most common area is usually the glabella, right between the brows, the forehead, the crow's feet around the eyes.
Yes.
I use it a lot in the lower face too.
Really? Okay.
For the marionette lines, because a lot of patients have this downward frown, and it's called the DAO muscle, but it makes a tremendous difference. You can't put a lot in there, but just putting in the right amount makes a world of difference.
And that's what it truly is. It's an art.
It is an art. How much you inject, where you inject, what are the points. It isn't something where you can just go learn it in like a conference or something.
Absolutely.
This has been my passion for like 19 years I've been doing this. So just tweaking the techniques, getting the placement right. I love it. It's very exciting and I'm very passionate about it.
I bet.
So,
and that's truly why it makes you unique. It's all about cosmetic and aesthetics here. That's truly your focus and it's truly your art.
Right.
And 19 years, that's huge.
Yeah,
that's amazing.
Yeah.
So we're talking about the cosmetic side of it, but what are some of the other benefits?
Yeah, so we also use it a lot for patients who have, for example, excess sweating. Okay, and that can be from the underarms, the palms, the soles, and also the scalp. Actually, lately we've seen a lot of patients with hyperhidrosis of their scalp. In New York, it's actually commonly used just for anyone who doesn't want to sweat from their scalp.
Oh, wow.
And it prevents you from having to wash your hair after workouts and things like that. So
I can see that.
That's also very
And I've heard about headaches, that it can help with headaches.
Yes, that's true. With migraines and tension headaches, sometimes just injecting in the cosmetic areas works on the tension headaches that originate from the forehead area. But if the headache originates from the back of the scalp or it's traveling, you can actually inject the Botox along the path of the migraine. And it's quite amazing how well it does work. We also use it for patients who have a lot of tension in their neck muscles. So that's another application. I want to say one more application that's very important is for bruxism.
Okay.
And for patients who have TMJ.
Oh, wow.
Or they have a wide jawline because of clenching. So that's very helpful, especially if you don't want to wear the mouth guards and things like that.
Right.
Yeah.
And how long does it last?
It'll last about 3 to 4 months in most applications. In some applications, if we're doing it for hyperhidrosis, for example, where we're using a much larger number of units of Botox, it can last anywhere from 3 to 12 months in some cases.
Wow. Well, I know that you are truly an expert with cosmetic and aesthetic treatments. You have 49 different treatments and procedures that you offer here.
Yeah.
So that's what makes it so beneficial to come here. You work with a doctor whose passion is truly the aesthetic side and the art of making you feel good from the inside out. So I highly recommend you coming and see Dr. Gupta. And what is your website to learn more?
Our website is Cincinnati skinandlaser.com.
Well, go and visit the website and like them on Facebook.